Okay, it looks like we got a good number of people into the room. Checking one more time. I think we can get started. I'm happy to introduce our speaker for today's Grand Rounds, Dr. Kramer, the senior clinical ethics fellow in the Ethics Center at UCLA Health. Prior to the fellowship, he completed a PhD in philosophy and cognitive science at the University of Arizona. In addition to his clinical responsibilities and teaching across UCLA David Geffen School of Medicine and the School of Nursing, he conducts research in clinical ethics, in particular philosophy of psychiatry and philosophy of emotion. His writing has been published or is forthcoming in the American Journal of Bioethics, Age of Neuroscience, Journal of Medicine and Philosophy, Neuroethics, and more. Today's talk is on the fittingness as a framework for discriminating affective psychopathology and should be a very fascinating and invigorating talk. So welcome, Dr. Kramer, and thank you.
Thanks so much, Dr. John. I appreciate it. And thank you to everyone who is in the audience. So this is a talk that's really based on some of these papers I have forthcoming. They're not available online yet, but if you want drafts of any of them, I'm happy to provide. Just get in touch by email. So the title is a little bit imposing, but it's going to be, I hope, a pretty smooth way of introducing some concepts from philosophy of emotion in a way that I think can be really productive for the practice of psychiatry and mental health professionals in general. So just to move on to the learning objectives, just to give you a sense of, and I'll have a roadmap in a second, but this will sort of give you a sense of where we're coming from. First, we're going to learn to differentiate the types of reasons that can justify emotion. So we're going to be talking about, in a sense, the rationality of emotions. We're going to understand the structure and genesis of fitting reasons for emotion, so singling out one category of such reasons. And then we're going to relate fittingness, this concept, to proper functioning, and to use this relation to clarify the concept of mental illness. And I'll be doing that by speaking about a couple different DSM diagnoses, diagnostic criteria. So I'm going to start with just talking about what fitting emotions are, what fitting reasons for emotions are. We're going to, as I said, relate that to the concept of functioning. We're going to apply that in 3 different cases to major depressive disorder, to adjustment disorder, and to prolonged grief disorder, which of course is a newer diagnosis that's been somewhat controversial. And then I'm going to close by talking about the implications that this view has for the ethics of psychiatry. So I'm going to start with this idea that's going to be core to the talk about the notion of a fitting emotion. And I'm going to come at it via some recent work in political philosophy and moral philosophy, which is done by Amia Srinivasan, who's a professor of philosophy at Oxford. And in her article, in which she talks about this notion of affective injustice, she relays this debate that was had at the Cambridge Union in 1965 between William F. Buckley, who's of course pictured on your screen here, and James Baldwin, the writer. And it sort of covered a lot of topics relating to civil rights of the day, civil rights for Black Americans. But in particular, it turned around this question of whether Black Americans, oppressed as they were, and having good reason for anger at their circumstances, should they forfeit that anger because it would appear that it would be potentially counterproductive? Namely, that by appearing angry, they were potentially alienating allies in the fight for civil rights. At least this is the line that that Buckley, as the sort of conservative side of the debate, was pushing. And Srinivasan wants to just sort of take that presumption, because there's actually some interesting empirical evidence on whether anger really is counterproductive in this way. But she wanted to take the kind of critique at face value. And she wanted to say that if that was the case, if Black Americans at that time were faced with a choice between feeling anger that was very appropriate to their situation and making allies by sort of quelling that anger, then in a sense, that is a further injustice that they are subject to, that is parasitic on the first order injustice that is the reason for their anger in the first place, right? And so she's saying, basically, there's this interesting tension between different sorts of reasons for feeling emotion versus not feeling an emotion, and that being subject to that tension can itself be a form of injustice. And so I'm going to sort of circuitously work my way back around to this point, I think in the context of psychiatry. But the core idea here that I want to get across is that many mental disorders are characterized by extreme emotions that impede daily functioning. But the question is, what should we do and what should we say about them if these extreme emotions are, like the anger of Black Americans during that time, in some sense warranted by the extreme circumstance in which the individual finds themselves? So I'm going to be talking about fitting reasons for emotion, but I should say something about what I mean by a reason here, because normally we don't think, we don't deliberate through what emotion should I feel in this context and then choose the emotion and then feel the emotion. That's not really how it works. We have lots of emotion regulation strategies that are pretty effective, but it's not that sort of thing. When I'm talking about reasons for emotions, I'm not talking about reasons that motivate us to have a certain state or engage in a certain practice or action. I'm talking about reasons that justify, that make sense of, and that somehow normatively support the responses we have, even if we don't choose what those responses are. And this is, our emotional lives are shot through with these kinds of reasons, right? Some of them relate to what is in a person's self-interest. These are maybe called prudential reasons. So maybe if you're happy, you'll seem more attractive to the date that you're at a restaurant with. We often talk about moral reasons for emotions. So for instance, that you should develop compassion in yourself because it will lead you to engage in more pro-social behavior, more helping behavior. Sometimes emotions are epistemically justified, meaning they help us produce knowledge. So for instance, if you're really angry when UCLA loses a football game, you'll learn something about yourself. Maybe if that anger takes you by surprise, you learn how much you care about UCLA football, whatever it is. The history of aesthetics is one in which emotions play a big role. There are some people who attribute much of their aesthetic success to their emotional dispositions, like people being melancholic and having that contribute to their mastery of romantic painting, or they're angry and that contributes to their production of punk music and things like that. And those are, in a sense, aesthetic reasons to have those emotions. And finally, we have the sorts of reasons that I'm talking about, which are fitting reasons, which are not, the main point here is they're not any one of these other reasons that might be more familiar to us. So let me take a moment to sort of characterize this relation. It's not morality, it's not self-interest, it's this thing called fittingness. First thing, to be very clear, it's not reproductive fitness, right? That's the concept that people might be familiar with here. I want to just make really clear that's not what I'm talking about. It is the sense in which emotions can seem merited or apt or correct, right? These are all sort of synonyms for fitting as philosophers use them in this technical literature. And one of the examples that's brought up that I think is a good illustration is that of jealousy that you might feel toward a colleague who's at a similar career stage as you, who wins a prestigious award that you were also up for, okay? We can understand how it seems like jealousy is called for or apt or merited by losing out to this colleague of yours. Importantly, it's clearly not morally justified to have this response, right? We might think it's bad of you, morally wrong of you to be jealous of your colleague. But even if we grant that, we still can see the sense in which this is an apt response to your circumstances. And so one other way of trying to get a handle on this, because it is a little bit ephemeral, it's hard to characterize. Some of the philosophers who have written about this analogize it to the relation between a true belief and the world, right? A fitting emotion is like a true belief in the sense that it correctly represents its object. it's also something that is independent from the value of that emotion to the agent or to other people. So the emotion here, the fitting reason, is justifying an emotion in terms of its relation to the object, to the cause of the emotion or what the emotion is about, rather than the value to an agent or others. I'm going to keep this analogy between fitting emotions and true beliefs because I think it's a useful one as a through line in the rest of the talk. So I'll point out here in relation to this question about value, that it can be bad for people to have true beliefs sometimes. For instance, you might have true beliefs about the probability of an outcome, like a lottery that you're participating in, or even the probability that you'll get into the medical school that you want to get into. Nonetheless, that can make you worse off because it can lead you to, say, have a defeatist attitude or something. Whereas someone's got to win the lottery and it's preventing you from being the person who does so. And someone's got to get into that med school and it maybe is preventing you from being that person. So the idea is that having a true belief can make you worse off, but we don't think that's a reason not to have that true belief. There's still a very strong reason in favor of having beliefs that are true rather than not, or at least that belief would still be rationally justified just in virtue of being true. The idea here is that fitting reasons would be justified just in virtue of being fitting, even if they lead to bad outcomes in some respect. And another way of getting a grip on what's going on here is to understand the particular view about emotions that many of these philosophers are operating with. So like the precise characterization will change from person to person, but I think this is a good representation, is that emotions, these authors say, involve evaluative presentations. So they purport to be perceptions or some other sort of representation of such properties as the funny, the shameful, the pitiable, and so on, and others, right? So we trade in these kinds of concepts, evaluative properties, all the time. We say that was a funny movie, or that snake is scary, and so on. And so the idea here is that part of what our emotions do, in fact, the principal thing that our emotions do, is they purport to represent those evaluative properties of the world around us. And that is, in some sense, why we've come up with these labels, right? We talk about things being shameful because we have this emotion of shame that represents the world to us in a certain kind of way, that represents events to us in a certain kind of way as being shameful. And so that emotion will be fitting, it'll be correct, it'll be apt when it represents things as they really are. When the thing you did really was shameful, then it is fitting to feel shame. Okay, so there's this kind of parallel between the type of emotion you're talking about and the evaluative property that it purports to represent. These things are supposed to hook up, and that's what fittingness essentially is. Now, before I move on, I want to make clear one thing, because I've mostly just been talking about emotions at this point, and some of the disorders that I'll get to later aren't just about emotional dysfunction or emotional dysregulation, but also about moods. And from a philosophical perspective, this might pose a problem, because although we can understand the sense in which my fear of a spider is about the spider, right? It relates to that thing in the world. Moods might not have this clear aboutness relationship in the same way. And historically, this is what people tended to think. So the technical terminology would be that moods lack propositional content, right? They're not about things. So they are in some sense irrational. There's nothing that would justify them. And therefore, they wouldn't be able to be captured by this fittingness concept that I'm talking about. Because fittingness is a relation between the emotion you're having and the object that it's about. So if there's no object out there that the emotion is related to, we can't assess the representation. So we've got this concern about whether moods can be captured under the framework I'm talking about. And the useful thing is that it seems like it maybe can, right? Recently, philosophers have been talking about how even if the objects of moods are diffuse, or maybe even just the world as a whole, they can still take objects, and therefore it would still be able to be accounted for in this framework. If you have more questions about how this works, I'm happy to do this in the Q&A. And I think another reason to think that these fit is that the sorts of things that we think are moods, like being depressed, having a depressed mood, we have similar sorts of affective values for those, like this such and so is depressing. Okay, so the fact that we make the same kind of terminological move in our daily lives indicates that at least there is a significant parallel between these two categories of affective response that I think we can make use of in developing the view I'm developing here. And so the takeaway here at this juncture is that an affective attitude, by which I mean an emotion or a mood, fits its object, so is justified in this particular kind of way, when it correctly represents the object's evaluative properties. And that correctness of representation is independent of any value or disvalue that that affective attitude has to the agent or even to anyone else. I say here that I give a little bit of characterization for how we might think of those properties, but I can talk more about that later if anyone is interested. So we now hopefully have some grip on the sense in which fittingness and fitting reasons justify affective responses, right? In which they are, in some sense, defensible because they are correct representations of things in the world. The question is, how do we connect this up to the idea of psychopathology? And I think that the mediating link between those two is the concept of function. So I'm going to talk about functioning. So the first thing to recognize is that, just as I talked about before, fitting reasons are one of a number of different types of reasons, different types of justification for emotions, okay? So what this means is that if fear is a fitting or an appropriate response, it doesn't mean that that is the thing that I am, all things considered, most justified in feeling, right? The other sorts of reasons might, in some sense, be stronger or be more compelling than the fitting reasons, because these can, as we saw, they can clash with one another. They can point in different directions as to what you overall ought to be feeling, rationally ought to be feeling. However, they are unique with respect to emotions. And I want to propose that they are not just a rational justification for emotions, but sort of a privileged rational justification. They're one that is sort of singled out for special use. This is because they derive their normative force. They are justifications for emotions, not because of any value they generate, but because they are related to the structure of the emotion itself, right? Emotions have this function, as I'll get to in a minute, of representing the world in certain ways. And it's from that intrinsic function of an emotion that we get this way of assessing the emotion, okay? So as some people have pointed out or articulated, they justify emotions on their own terms, as opposed to on general grounds like morality or self-interest or something like that. And so because this sort of justification is special when it comes to emotions, because we're not talking about fittingness when it comes to actions or other sorts of attitudes. We're just talking about, it really only makes sense to talk about it the way we do in the context of emotions. And that seems to indicate that it would have some kind of distinctive role to play in the rationality of emotions. And again, this is a connection to this analogy between fitting emotions and true beliefs, because we think that epistemic reasons, that is, reasons that have to do with the truth of a belief, have this similar sort of role in relation to beliefs. Okay, we might have other sorts of reasons that we could take on a belief, like I talked about before, maybe be really useful not to recognize just how low your chances of getting into a particular program are, but the truth of a particular belief seems to be the most compelling sort of reason that stands in favor of it. And again, I want to say that fitting reasons do the same thing with respect to affective states. So, like I said, systems can have many functions, some of which will be intrinsic and others extrinsic. What do I mean? Well, there are different ways of sort of characterizing that, but an example is maybe more helpful. So consider the heart. one function of the heart is that it circulates blood. Okay. Probably intuitively, we think that's an intrinsic function of a heart. That is just the sort of thing that hearts do. Another thing that hearts might do is that they separate squeamish from non-squeamish medical students, right? They might determine whether you decide to become a cardiologist or maybe become a psychiatrist or something like that. So these are both functions of hearts. These are things that hearts do. But we have this intuitive sense that one of them is more closely related to, is more intrinsic to a heart than the other one is. The other one is sort of contingent on external factors. And so we could assess whether systems are dysfunctional along any of these sorts of functions. This is a bad heart because it's not pumping blood well. This is a bad heart because it's not separating out the squeamish medical students. But if we just think about dysfunction generally, or if we think about what sense of dysfunction really matters, we're probably going to choose the intrinsic functions over the extrinsic ones. And importantly, it can be overall beneficial for a system to malfunction, right? To not function exactly properly. And it can be overall detrimental for it to function properly, depending on the environment in which the system is located. Okay, this is a point that philosophers of biology, philosophers of cognitive science make in context of environmental niches, right? So there's a famous example by the philosopher Jerry Fodor, who talks about frogs and their visual detection systems. He imagines these experiments done by a rather unethical sort of biologist in which they shoot both flies and BBs, like from a BB gun, past the frog. And the question is, what does the frog's visual system do? Does it represent flies, in which case it's only going to stick its tongue out at the flies? Or does it represent small black moving objects, in which case it's going to go for the BBs too? The function of that system could be to represent small black flying objects, in which case when you take that frog out of its normal environment, where the only sorts of flying black objects are flies, and put it in this awful person's lab, it's going to be bad for the frog because it's going to swallow a bunch of BBs. Okay, so that's the basic idea in which it can be bad for systems to function properly. It is, in principle, a system's functioning is distinct from what is beneficial for it. So the proposal, because again, I made this point that what the fitting response might not be the thing that is most overall beneficial to you. Evaluative representation is the core intrinsic function of emotions. Not only is it one of the primary things they do, it's something that we think is related to their nature themselves, right? It doesn't just happen that emotions represent the world to us in these ways. That is more or less what they do in the same way that a heart pumps blood. And the fact that that can function well, but that can be overall bad for the agent is sort of unrelated. Fittingness could still thereby be the best measure of their proper function. And in fact, that's what I want to say, that whether an emotion is fitting or not gives the best indication about whether your emotion systems are properly functioning or not. So now we can sort of see where I'm leading with this idea about psychopathology, because the notion of psychopathology, the notion of mental illness or mental disorder, is highly related on a number of views to this idea of dysfunction, right? So maybe the most popular one is from Jerome Wakefield, who says, or who argues for the idea of mental disorder as harmful dysfunction. Okay, so you have to have some core element of psychological dysfunction if you're going to have a mental disorder, and not just some state of functioning that is distressing or something like that. Now, of course, the difficult question here is how to generalize or how to generally characterize psychological dysfunction, right? You might want to explain it in terms of brain states or something like that, but our science is only so advanced. And what I'm leading toward here is the idea that, of course, fittingness should be the way that we understand the functioning and therefore the dysfunction or the malfunctioning of certain psychological systems, namely the emotional ones. And I want to just sort of preface that idea by saying that some philosophers and some theorists, some psychiatrists throughout history have argued that there is this close relationship between mental disorder and irrationality. And that's the sort of view that I'm proposing, that certain sorts of mental disorders, namely affective psychopathology, right? Mental disorders primarily involving the dysfunction of emotion and mood systems, are essentially cases of irrationality in the sense of systematically unfitting affective responses, right? That's the basic view that I'm proposing here. And again, to carry through the analogy between fitting emotions and true beliefs, I think that this is analogous to the sense in which we think that things like delusional and psychotic disorders are instances of mental disorder. These are circumstances in which the patient is unable to form true beliefs about the world outside of them, right? Their cognitive systems are not functioning properly, and that's indicated by an inability to form true beliefs about the external world, in some sense, systematic. Similarly, for, I think, the whole suite of affective psychopathology, I think what is going on is an incapacity to correctly represent the evaluative features of the world. And we're going to see that in a couple different applications. In fact, I think this is something that psychiatrists, at least as represented in the DSM, which I know a big caveat about that, but I think that this sort of thinking is already in practice. However, gaps remain, maybe because psychiatrists have not yet had access to this concept from philosophy of emotion. And I think where it fails to be accounted for, where fittingness fails to be accounted for, at least something like it, this seemingly invariably leads to concerns about diagnostic inflation or over-medicalization of daily life and normal affective experience. So I think the first place we see this is in major depressive disorder. So in the DSM-4 text revisions that came out in July 2000, they introduced this bereavement exclusion, quote unquote. It is an exemption essentially from a diagnosis of major depressive disorder if your symptoms are due to bereavement, namely a normal period, quote unquote, of normal, quote unquote, bereavement. So Horowitz and Wakefield, criticizing these developments, say, what is the problem that they have with this definition? The essence is that aside from a few exceptions, the presence of a particular group of symptoms is sufficient to diagnose the presence of the disorder. Yet, these symptoms might naturally occur in the absence of any disorder after any of a wide range of negative events. Just as it's obvious why the DSM excludes bereavement from the diagnosis, by parity of reasoning, it seems obvious that it should also exclude these other sorts of reactions to negative circumstances. Basically just saying, why is it only a bereavement exclusion? There are lots of life circumstances that people are in where they would have these affective syndromes that are superficially very similar to a major depressive episode or a major depressive disorder. And yet we think that they are, in some sense, justified by the conditions they're in, not just bereavement, but other ones too. So they say the basic flaw of this definition, as well as of all efforts that rely on it, is simply that it fails to take into account the context of the symptoms and thus fails to exclude from the disorder category intense sadness, other than in reaction to the death of a loved one that arises from the way that human beings naturally respond to major losses. Now, I want to agree with this line of reasoning and say that it represents my own view, except with one amendment, that it's about the way that human beings rationally respond to major losses. Rationally here in the sense of fittingly respond to major losses. So this sort of critique has been taken on board by the authors of the DSM. So in the DSM-5 text revisions from March 2022, you get this note in the diagnostic criteria for major depressive disorder. I won't go through the whole thing, but I will note that they say responses to a significant loss, which now they include not only bereavement, but things like financial ruin, losses from a natural disaster, a serious medical illness. Such symptoms that come from that may be understandable or considered appropriate to the loss. The important thing here is that that is precisely the sort of terminology that you use to talk about fitting emotions. These affective responses are in some sense fitting to the loss, but they also acknowledge the presence of a major depressive episode in addition to the normal response to a significant loss should also be carefully considered. Okay, so I want to say that the way that they've accounted for this kind of critique is essentially by adopting something like a fittingness constraint on what counts as an appropriate or inappropriate response to a significant loss. And they've acknowledged that this affects whether you have this diagnosis, whether you have this condition or not. Now, you may be worried about stressor-related disorders because the idea is that those presume that there is some stressor in your life to which you are responding emotionally in a particular kind of way. And I think that that's the right sort of concern to have, although it's not necessarily the case that a stressor disorder or a trauma disorder would inherently be would fall afoul of the proposal I'm having here. But I want to show you where I think there would be concerns about it. So this is the DSM criteria, or at least part of them, for adjustment disorder. So first, it talks about a particular stressor, an identifiable stressor, and then development of emotional or behavioral symptoms. And then they note that these symptoms or behavior are clinically significant, as evidenced by one or both of the following. One is that the distress that is experienced as a consequence of these stressors is out of proportion to the severity or intensity of the stressor, which again, I want to point out is a fittingness kind of language, right? Fittingness is about a matching between the evaluative properties of that experience or that event and your emotional response to it, or your affective response to it generally. So things can be unfitting, responses can be unfitting because even though they're the right kind of response, they are disproportionate, right? You are scared to death of a rat that walks by, that scurries by or something like that. So this seems like them taking on board this kind of thought. But again, this is a disjunctive definition. You can also be diagnosed with an adjustment disorder if the symptoms are clinically significant in the sense that they cause significant impairment in social, occupational, or other important areas of function. Okay, so even if your response is not understood to be disproportionate, as long as it causes difficulties in engaging in tasks of everyday life, it would be considered a mental disorder, specifically an adjustment disorder. And I just want to point out that one, that's something that my view would not understand as a mental disorder, and two, that this sort of criticism of a syndrome like that being understood as a mental disorder is precisely the sort of criticism that's raised against adjustment disorders. So Bauckham and Casey, right? There should be clear lines of demarcation between normal emotional responses and those that are pathological. So it was envisaged by the architects of the DSM-4, in which I think adjustment disorders were first introduced, that over time, clear biological and other distinctions would emerge to delineate the boundaries between disorder and non-disorder. This has not happened. It raises the specter of psychiatric diagnosis being made on the basis of distress symptoms alone, prompting accusations that problems of living are being medicalized. So again, you have problems in your life. They cause rational, they produce rational, again, fitting, emotional responses that disrupt your everyday functioning. And the question is whether that alone should constitute a mental disorder or not. And I'm saying it should not, because it's not a dysfunctional response. It is just maybe an extreme response, but it's an extreme response to extreme circumstances. Similarly, they use more sort of fittingness related language. Since there are a few areas of life in which we have knowledge of the appropriate response to a stressor, deciding on what is normal and what is an excessive response, again, the proportionality, is a clinical choice with little to guide the clinician. Okay, so that's two different cases in which we've seen critiques of a particular definition of a mental disorder made on the basis that essentially they failed to take into account this fittingness understanding or this fittingness criterion for emotional dysfunction. Finally, we're going to come to prolonged grief disorder, which is new in the DSM-5 text revisions, although it's been discussed for several years prior to that. I'm not going to list all the diagnostic criteria here, but three of the sort of core ones are that it is a response to a death at least 12 months ago of a person who was close to the bereaved individual, that the disturbance causes clinically significant distress or impairment in social, occupational, or other important areas of functioning, and that the duration and severity of the bereavement reaction clearly exceed expected social, cultural, or religious norms for the individual's culture and context, which might be thought, that last one, as a kind of fittingness criteria, but the question is how you characterize it. So some of the criticisms that have been raised are precisely having to do with what constitutes a normal or a normal course of bereavement. So Kleinman writes, across the world, societies differ greatly in what they regard as normal grief. Some do regard a year as a marker, yet others sanction longer periods, even a lifetime. In fact, historically, widows in many patriarchal societies were culturally framed as grieving for a lifetime or at least a long time. So we can understand these as cultural attitudes toward the fitting duration of grief, like what length of bereavement is appropriate as a response to the particular loss you had. And the idea is that if you're a widow, if the loss is the loss of your spouse, specifically, I think your husband, then that merits grief for the rest of your life. Another different sort of response to this is to point out that the most common rates of prolonged grief disorder are in those who are responding to particularly tragic deaths, for instance, from substance overdose. And you might think that the, let's say, the tragicness, the violence of a person's death might affect how long it is fitting to grieve that death. Okay, I think this is a way of fittingness is, again, a lens through which to understand these criticisms that are raised about this diagnosis. Now, entirely independent from what psychiatrists and other mental health professionals have written about the disorder, this is Chris Howard, who's a philosopher at McGill, writing about fitting grief. He makes this sort of basic argument, basic characterization. He says, grief is a fitting response to loss. What makes grief fitting is the disvaluable loss itself, in particular, the features of loss that make it disvaluable, right? The fact that it was your spouse that died is what makes the loss a bad loss for you. The loss continues to be a loss forever. It's not like you get your spouse back. And the features that make it disvaluable, namely that it's your spouse or someone, persist. So, he concludes, it is fitting to grieve the loss forever. Grief as a response to the loss is a forever fitting feeling. So these authors, and he's not the only one that defends a view like this, are defending the view that a loss merits grief indefinitely, that it is always appropriate to grieve following a loss. And they don't have in their minds anything about prolonged grief disorder at all. But I would just say that if they're right, and I don't actually think they're right, but that's for another time. If they were right, that would be some reason to think that these critics of the idea of quote unquote pathologizing grief at all would be right, because you would be characterizing an appropriate rational response, even if it's not one that is overall best for you, as a mental disorder itself. So I want to close by considering what this means for psychiatric ethics. And I want to return to this point about affective injustice that I raised at the very beginning. So I think this is a principle that's hard to deny. Insofar as mental illness is stigmatized in a particular society, it is a harm to receive an inappropriate psychiatric diagnosis, right? You're receiving a label that you haven't earned, and it's a label that carries societal burden. This would be not just a harm, but an injustice if the reason that you were given that diagnosis has to do with a systemic injustice or oppression that you are subject to, right? If the reason that you're given that inappropriate label is because you are economically immiserated, for instance, through no fault of your own, then that harm would be an injustice. And at least in terms of some of these, I think this is the point that those authors were making about prolonged grief disorder and tragic violent deaths. Economic immiseration, something like that, might lead to an increase in violent crime in your area or make you more likely to be subject to violent crime to you and your family. And if that is more likely to give you a diagnosis of prolonged grief disorder, when in fact your grief is a perfectly merited or appropriate or rational response, then that would be an instance of you receiving an inappropriate psychiatric diagnosis because you are already subject to conditions of injustice. Now, not everyone who is misdiagnosed in the way that I'm suggesting would be so because of some injustice in the world, but I think that that might explain at least some of these cases, and that's something that to really take into account. The other thing that has to do with affective injustice is I describe that as a kind of like a double bind, right? You either have the emotion that's appropriate to have, but you alienate allies, or you quell your emotions and in some sense deny something that is a totally appropriate response in order to pursue these strategic aims. And being subject to making that kind of choice, insofar as you're able to make that choice, would be, in some sense, an injustice. So I think a similar thing is going on here, right? If, say, you are in miserable material circumstances, and so you display all the common sort of symptoms, or at least a range of the symptoms associated with major depressive disorder, for instance, then you're sort of subject to the same kind of double bind. Either you have your rational responses to your conditions pathologized, right? A psychiatrist tells you you have major depressive disorder when in fact you're depressed because your circumstances are depressive. But that's the only way to get treatment that alleviates your distress, that allows you to function better in society. Or you get proper justification for your responses, recognized, right? They say, makes sense, that that is an appropriate sort of response to have in the circumstances in which you find yourself. But if treatment is tied to a diagnosis, then you don't get any sort of treatment. You don't get any way of having relief of your symptoms. And so you suffer. And so this is a kind of like double bind that I think that people can fall into. They can either accept what is an appropriate diagnosis, but then have improvements in functioning and relief from distress, or they can have it recognized that their response is an extreme one, but it's one that's appropriate to their circumstances, but then they might be deprived from things that better their lives. And so the question will be how to address that from a disciplinary and a professional standpoint. One is that it just suggests a kind of disciplinary obligation to advocate for an amelioration of systemic inequalities if they're contributing to common occurrences and common instances of this kind of double bind. But the other thing, and that I think is suggested by some of the critics of that I've talked about, including critics of prolonged grief disorder, is to address it within a quasi-palliative framework, right? So it may be the fact that even if these people don't have psychiatric conditions, if they don't have mental disorders, psychiatric interventions may nonetheless benefit them and contingently address non-psychiatric problems. And so I think this is suggested by Cacciatore and Francis when they say some grieving people, again, talking in the context of prolonged grief disorder, some grieving people will need extra support, although primarily because of the circumstances of the death and the closeness of the relationship, not because of pathology. And thus we disagree that a diagnosis is required in these situations, right? So they're proposing there are still ways of addressing your not only the root causes of your emotional experience, but the sequela, if you will, of the emotional experience of yourself. And that doesn't require us to understand your response as one that's pathological. It just requires us to be sensitive practitioners. So that's all I have. I've got references here that I can send if anyone is interested. And I just want to thank you all for your time.
Applause in
Yeah.
the room.
Let's see. I think
Let's see if we capture any questions
not
over
that
here.
one.
And we'll stop
Yeah.
share. We'll stop share and pick up the chat and the webinar. Okay, so we have some chat.
So I think questions should be directed to the Q&A.
And then we'll see the Q&A. Okay. First, let's check if we have any questions in the room. Any questions? No, not currently. Okay.
Yeah, we can talk about those.
You got all that? No, well, we can hash it out here and now. And then feel free for all the folks who are online to pop in anything into the question and answer so we can pick it up. And all right, just a couple of things that were really relevant to screen sharing. So I found that very fascinating, and I am not a professional ethicist or philosopher in any way. I'm a practicing psychiatrist, and I couldn't help but try to approximate the concepts of fittingness to what I and probably others do in everyday clinical practice. And these are some of the thoughts I was having. I just open this for your reflection.
Yeah, please.
The concept of fittingness seems to be familiar, at least to me, as somebody who sees patients and may attempt to the best of my ability to discern was the emotional response that they had to a particular situation situationally appropriate,
Yeah.
maybe the catchphrase that a lot of people say, or
Right.
appropriate to the context.
Right.
The loss of a grandmother that had raised him since he was 3 years old, abandoned by his parents. And the loss, for his grandmother to die, the loss would be sad and fitting.
Yeah.
And one thing that comes to my mind is the pathology or let me take away the word pathology, I'm going to remove that. The conditions where a patient does not experience the fitting response to that situation, because in this particular scenario, the gentleman had built up a certain number of defenses over time. Sure. That caused him to deny that his grandmother had died, who took care of him for so many years, in light of his abandoned parents. And in some ways, for him to experience the fitting emotion, which would have been profound sadness, may have been particularly dangerous to him. Yeah. He was suicidal at times. He may have gone off to kill himself in the sense of all that grief. So it came to my mind as you were describing some of that, the concept of fittingness makes sense there. And that the therapy for him over time was actually to reconnect him to what would have been fitting. Yeah, precisely. Which he couldn't experience, right, because of his history and because of the coping that essentially became a survival mechanism. I shall not feel emotions that are extremely distressing, even if they're fitting, because I can't handle them. Yeah. So yeah, I mean, I think that's a good sort of inverse of the cases that I used here, where someone is having this intense emotional response and it's appropriate, and that's a reason to think that what they're experiencing is not a pathology. You're pointing to a case where someone is preventing themselves, in a sense, from feeling what is appropriate, and that's a reason to think that they are having a pathological response to those circumstances, that their coping mechanisms are in some sense pathological because they're depriving themselves of being able to interact
emotionally with the world in an appropriate format. So I think that's exactly the kind of proposal that I'm making. It fits very harmoniously with that. And I mean, I think I really don't want to misconstrue what I'm doing to suggest that it's entirely novel. I think it's just a way of giving the practicing psychiatrist, the practicing mental health professional, as you say, you talk about whether emotions or responses are situationally appropriate or context appropriate or not. This is really just a way of sharpening that that way of speaking or that way of interacting with some sort of philosophically robust concepts that hopefully also allow for a more systematic theorization of what makes something situationally appropriate or contextually appropriate. So I think that what I'm doing is very congenial to ordinary psychiatric practice. I just hope to be giving language and giving concepts so that it can be a kind of principled way of doing so, and that you are not without the conceptual resources to really address cases like that.
And that makes perfect sense. In fact, what we probably do oftentimes working in the hospital, dealing with patients who have been handed let's say a very difficult diagnosis, medically bad news, and are experiencing a heavy set of emotions, is to come in and validate the fittingness of those emotions to the situation. And as psychiatrists in particular, probably therapists as well, you made a point about feeling a bit boxed in by diagnoses and having to assign a label to something, whereas the label can be harmful.
Right.
If you call the sad person who just got told that they only have 6 months to live depressed, that may be doing them a disservice. Talking about the loss that occurs with that, the demoralization, the mental shift that is happening that has shaken their world, is very validating to say this is a fitting emotional state to what you've just been told.
That's right. Yeah, and I think that is really what I hope the upshot is. I see there's some.
So we'll pick up a couple here now that we've gotten going. We have a comment, maybe a question in here. Their underlying assumption is that life should be just and fair versus accepting the reality of life throughout human history. What if everyone accepts that life is not easy nor always fair? Couldn't that mitigate a lot of these dysfunctional responses and change one's idea about fittingness?
Yeah, that's a good question. So the question there is really one about how we should, whether fittingness is sort of tied or indexed to what your expectations are about the world, right? If you don't expect your circumstances to be any better than the terrible ones that they are, then why would you be depressed? That's just the way things are. I mean, I think that that's an interesting way of putting it. I don't think I'm assuming that any deviation from an ideal life would be a fitting reason for extreme emotional responses. So, I think this is where the points I made about proportionality fit in, because even something like prolonged grief disorder, it's not just that you feel sad or feel a sense of loss after a year. It's that you have intense bereavement symptoms, intense feelings of loss beyond that year period. And the question is whether that could still be proportional to the loss or not. So I think that some of the concerns that audience member raises can be alleviated by recognizing that it's about proportionality, maybe more than just how far does this deviate from the ideal life. It's also about systematically unfitting responses. So, in many cases, we have unfitting responses all the time on a daily basis. The question is whether those reflect a basic inability to recognize or engage with the values in the world. And one-off failures are not pathological. It's a systematic failure that would be pathological.
Over and over. Yeah. Let me read a couple more of these before we run out of time. Does Donald Hoffman's thesis about emotions and perceptions evolving for survival value, not objectively real truth value, support or conflict with what you're saying?
That's a great question. So I have to admit, I'm not totally familiar with Hoffman and his work himself, but I get the sense of the view just from that. So I think that if you take the view that the primary function of emotions and perceptions is just about you know survival, then you can't get a view like this off the ground.
Yeah.
You have to, because the way the view is supposed to scaffold is that you understand that mental disorders involve dysfunction, and then you're understanding dysfunction in this particular kind of way. And the particular kind of way is pointing to a particular function of emotions, namely that they represent the world in its evaluative properties. If you don't think that that's what emotions do, then nothing that's built on top of that is really going to stand. Now, I think I think that that's, although it's a parsimonious view about what emotions and perceptions do, I think it's a rather dim view of our emotional lives. I think that maybe there was a point farther back in our evolutionary history where you really can characterize the value or the function of any of our psychological systems in those evolutionary terms. But I think that once we are like in the current state that we're in, we have social emotions that are very hard to tie back to some straightforward concept of individual survival or individual reproductive fitness. And I think that a lot of the emotions that we're talking about, it's not just say, so a phobia disorder is really easy to characterize in terms of fittingness, right? If you're afraid of window blinds, you say that's pathological because window blinds aren't scary. But a lot of the stimuli that are prompting unfitting emotions are rather removed from anything concerned with survival. And I think that there's a real reason not to take a sort of narrow evolutionary view about these parts of our psychological faculties.
Yeah. Great. And I think this one's just maybe a comment and we can close on this. Thank you for the excellent talk. It really is relevant to what we do. It also seems relevant to trauma and to moral injury. It is my perception that there's a lot of quote trauma and a lot of quote moral injury, which results in emotional reactions like anger, depression, anxiety. The problem is not creating infinite quote patience out of those situations due to the prevalence of these phenomena and what results in these emotions.
Yeah, Donna, I think that's a really good way of putting concretely this sort of abstract view that I'm proposing. I think that's really congenial to the project that I'm trying to advance here, and I appreciate you for making that link. So
great support. Well, that's all the time we have here at noon. Thanks for joining the grand rounds for everybody online and the raucous crowd here today. Thank you all. And Dr. Kramer, thanks so much for a great talk.
Thank you, Dr. Chung. I really appreciate everyone. Thank you.